Welcome to Health Talk. Today we're going to talk about sudden cardiac death. With us today we have Dr. Paul Wang, Professor of Medicine, Director of the Cardiac Arrhythmia Service at Stanford University School of Medicine, and Dr. Vikas Yalapu and Mary Gao. We're going to talk about this topic, sudden cardiac death, because 1,000 people die every day in America from this. And so tell us, Dr. Wang, tell us what is sudden cardiac death?
Well, thank you for having me here today to discuss this really very important topic. Sudden cardiac death is literally a public health crisis in America, and it's something that really is under-recognized. So I think it's very important for shows like this that appeal to the general public to educate them on really this condition. I think if you asked a group of people, your friends, relatives, and you said, gee, there's a condition in which 1,000 people die today, every day, and it's probably something you never heard about. And they would say, oh, this is strange. I mean, I've heard about everything. I've heard about lung cancer, breast cancer, all kinds of other conditions, but I've never heard about this other condition you're telling us about. And so that indeed is sudden cardiac death. The challenge or the description of sudden cardiac death is that people die suddenly. They literally have a collapse and then typically die and are not resuscitated in most situations. And that leads to this very high fatality risk in this situation. So that I've heard people say that indeed 2 747s crash every day. And of course, literally, they're not crashing. That's the number of people who are dying in the United States alone of sudden cardiac death. And so one of the key issues is really that of awareness. And I think particularly because it's a public health really crisis, a public health problem of a very enormous magnitude, the solutions are largely going to be in our population. So as people make decisions in our communities that affect and are going to help solve the problem of sudden cardiac death, we need support and awareness in our communities. That is, some of the most basic kinds of steps that you can take relate to the emergency medical services, supporting them. So when there are budget cuts, that we don't cut those kinds of services. And so it's very important that we concentrate in terms of supporting these different avenues that can make big strides in treating.
There's a difference between a heart attack and sudden cardiac death, and there's confusion. Tell us about that.
Yeah, that's a great question. So when we talk to the patients at large, the general population, you may talk to a relative, and you've heard that a relative has died at a particular age, and they say, well, what did they die of? And they say, oh, I'm not sure. I think it was a heart attack. The question to go beyond and ask is did they die suddenly? And so that often is a very, I think, unfamiliar question to most patients. They don't really think, well, why are you asking whether it's sudden or not? And so that's really a very important clue from a analysis point of view, from a medical point of view of why it happened. Meaning that patients that die suddenly typically can die of this kind of mechanism, which we call sudden cardiac death, the majority of which are due to rhythms in the lower heart chamber. So I think we have a model here today, and I'll lift it up so we can see this. And so you can see that, in fact, that there are upper chambers and lower chambers. So this is like a two-story building. The top floor are the atria, and the bottom floor are the ventricles. The ventricles are particularly important because they're what pump the blood through the body. So when the ventricles don't work well, you're not getting blood flow to the rest of the body, the critical organs, the brain in particular, but the rest of the body will no longer function. And that leads us to really the biggest challenge in sudden cardiac death is that it is in fact sudden. So what do we mean by that? Well, I frequently use the description when I talk to lay audiences that if you have a certain kind of condition, you may have a certain kind of infection, you might have even a mass in some area. Generally speaking, if you went to the doctor one day and you go back to the next day, that condition is still there. On the other hand, if you have a serious ventricular arrhythmia, a minute before it occurs, your electrocardiogram can look entirely normal. And the rhythm, for all you can tell, is perfect. But then seconds later, the rhythm can change. So that it's that rapidity, that sudden change in the heart rhythm that is in fact the biggest challenge. The second biggest challenge is that when this life-threatening arrhythmia occurs, the degree to which the pumping of the blood decreases is so dramatic and so rapid that the body can not sustain itself except for just a few minutes. So one only has a few minutes to act and convert the rhythm back to normal. What we've learned, fortunately, that if you can convert the rhythm back within a matter of several minutes, the survival is very high. The difficulty is, in our general population, it's very difficult to get that degree of rapid response. We can't get to the patient in 5 minutes. It can take many, many more minutes, and that's where the survival is so low. In the United States alone, in most communities, the survival rate still is 10% or less. So you have a condition that is 90% fatal in most communities. Now, I must say that some communities have done a particularly good job, and that's largely related to two factors. One, emergency medical services, and also a special device called an automatic external defibrillator, or AED. Now, AEDs are probably, and I hope, familiar to all of you. As you go by in an airport, all airlines have automatic external defibrillators. And depending on the state and the community, in the state of California, for example, all fitness clubs must have an automatic external defibrillator. And so they're throughout our community, and in fact, therefore, the general public needs to be aware of their existence, because simply having one mounted on the wall doesn't save a single life. One has to know that one can take it off the wall and apply it. And luckily, the technology has emerged that these are very safe for lay people to use. They're not designed just for specialized personnel to use these. So though you can go through a treatment, educational session to teach you about how to use an automatic external defibrillator, lay people should not be fearful of using these.
It has a voice activation.
Yes, exactly. So we call it the graphical interface. So the interface is very simple. The fact that it uses a voice, you do not need to be able to even read it. You can simply listen to the commands, and it will say, open up the package where the pads are, place the pads on the patient. It will say, I'm automatically analyzing the rhythm. So it does all of these things automatically, and will really only ask the assistance of the bystander at these points when it specifically asks for it. So that's what makes it quite successful, and in my opinion, really one of the most important advances that we have today already. So it's not as if we have to go and invent a new technology. This technology is already with us and readily available. It's really the need of the community to support placing AEDs throughout the community, and the need to educate the overall population to use these. So if someone collapses, they know, oh, that's a collapse. That's when you should use these. I think sometimes the general public thinks, well, there's some other condition that they're made for. It's not just someone who passes out. Passing out isn't the same thing, but it is. If someone loses consciousness, the very first thing you should do is try to arouse them. If they're not arousable, call for someone to get the AED immediately and call 911. So we have, I think, a very successful and important way in which we can get out the information to the general public of ways to improve survival in our communities in terms of reducing the fatality from sudden cardiac death.
Now, in Las Vegas, the casinos, they're really good for resuscitating. Tell us about that.
Yeah, that's a great question, and really an interesting fact. So I often, when I talk to lay audiences, I ask them, well, where do you think the survival of having a cardiac arrest would be the greatest? Is it in a gymnasium? Is it in an airline? Is it in a hospital? Or is it in a casino? So it turns out probably the highest success of survival is actually in a casino. And so in addition to being an interesting fun fact, there is actually a great deal of knowledge that comes to the front in realizing that. And so what is the factor there? So it's the ability to respond quickly, the ability to identify that someone has collapsed and get to them the AED. So as I've mentioned, those are the only real factors: identifying that the patient's collapsed and getting them the AED. That's all the casino has. But because people are in a very tight space in a casino and there's someone always watching you, well, they're not watching you for this purpose, but they're watching you nonetheless. And so they have now developed a very, really terrific system where people these are personnel that work in the casinos, they know when someone collapses to bring the AED immediately. So that leads to this very high survival, much higher than in any other locale or city that we have, because they're witnessed. And so that's one of the key ingredients that we still need to work on in terms of being able to have availability of AEDs and have this degree of awareness. New technology in the future, I hope, will solve the problem when people are not witnessed. That remains still the unsolved problem, in my opinion, because if someone collapses and they're not with family members, they're either out in the garage and they're working in their own or someplace else where there aren't people with them, no one's there to call 911. So unfortunately, that will turn into a fatality, which is unnecessary. So if the patient, in future technologies, we can identify ways to have these people so we can see the fact that they've collapsed and that in fact AEDs can get to them rapidly. That's something I would love to see.
This is such a huge challenge for American medicine. Now, what are the risk factors? We might just all drop dead, so we should find out what the risk factors are.
So yeah, that's a great question. I think the biggest challenge is that many of the patients who do die suddenly do not have diagnosed heart conditions. So I would say those are the two major categories. Some people, in fact, have known heart disease. And so in the United States, that's most commonly prior heart attack. So patients with prior heart attacks are at increased risk to have sudden cardiac death, die suddenly. The other group are patients that do not have the diagnosis, and there are a number of different conditions. So how could one assess what's the risk of sudden cardiac death? And so currently there are a number of different ways in which we do that. So if someone has a weakened heart, something where the heart is not pumping as efficiently, that patient may be at the threshold that in fact their risk is fairly high to have a serious event such as sudden cardiac death. Once we identify those patients, and that can be done very simply, typically with an echocardiogram to assess the degree of heart dysfunction. There is in fact an index called the ejection fraction, the percentage of blood that's pumped out with each heartbeat. Normally it's 60%. When that percentage goes down to 30 to 35% or lower, that risk of having sudden cardiac death in that individual is very significantly increased compared to the normal patient. So for those patients, there may be even strategies of which they can actually have a treatment in which that it can prevent the episode of sudden cardiac death or adequately and quickly treat it. As I mentioned earlier, the key ingredients or the key finding has been that if we are able to convert the rhythm rapidly, the patient will survive. So a new technology that's been developed over the last couple decades is called an implantable defibrillator. This is a pacemaker-like device that's implanted, typically in the upper chest, and that is then used to convert the patient's rhythm. So in essence, I think the lay public can view it as a portable or implanted automatic external defibrillator. So instead of being external where someone needs to be there to deliver it, the patient's in fact protected 24 hours, 7 days a week. That is, because it's implanted, it can rapidly detect within seconds that the rhythm has occurred. And when detection and conversion occur within seconds, the survival is very high, nearly 100%. So for those patients, that then becomes the most effective treatment that we have currently to prevent sudden cardiac death. So that's an important thing that in advising the general public is to know what your your risk is. So if you've ever been told of a heart attack, your family member has been, or they've been told of a weakened heart or have a certain kind of form of congestive heart failure or heart failure, that's an appropriate question to ask. Do I have a risk of sudden cardiac death? How high is that risk? And do I therefore, would I benefit? Should I have an implantable defibrillator, this pacemaker-like device which can be implanted to help that patient? So those are probably the most commonly used strategies to identify the patients at high risk and then to know whether that person needs to be treated. There are other clues that one can get. Sometimes it's a patient has had some symptoms, so that may be unexplained dizziness or more seriously passing out. So that is one of the very key reasons why most patients are advised when they have passing out episodes to seek medical attention. At least have a healthcare professional take a careful history and do a physical examination, and typically get an electrocardiogram. And in doing so, they'll have the initial steps in evaluating that patient. Some patients may need to go on and have an ultrasound of the heart, an echocardiogram, to look for these abnormalities that may lead to an episode of collapse, passing out in that case. Because those patients that have passing out might have a serious form of heart rhythm problem we call ventricular tachycardia. And ventricular tachycardia can, in fact, lead to sudden cardiac death. So the patient who has loss of consciousness, their evaluation may uncover this kind of problem and therefore save their life. So we're really very, we want to emphasize to the lay public watching this that that is a reason to get evaluated. If you have episodes or had an episode of passing out, getting medical advice is an important thing to do. And so that may be one of the things that lead us to, in fact, identifying those risk patients who may have sudden cardiac death.
Dr. Ilapu, you said you had family members with a lower ejection fraction, but they recovered. Do people recover? Why don't you tell Dr. Wang about your case, your familiarity?
Sure, I'd be glad to, Dr. My mother actually developed heart failure due to a viral myocarditis. Her ejection fraction went down into 15 to 20% range. Eventually, through medication, she was able to bring it back up, but we did have a little bit of trouble identifying at what range she was going to be at risk for sudden cardiac death, and how would we go about managing this risk in patients with these pre-existing conditions?
Yeah, so that's a great question. So identifying the degree of dysfunction is probably the single best way and the simplest way. So in a very easy office visit, you can assess typically with an echocardiogram or there are other imaging techniques, you can assess how impaired is the heart function. There may be some circumstances where it may recover, either on its own or with medication, so that is something one would keep track of. But in most circumstances, the heart function may only modestly improve and not enough to take the patient out of a range of risk to one, that they're in risk, and then to one that they're out of risk. So that's the decision, a pretty subtle decision sometimes, to make that determination. Do they need an implantable defibrillator or not? So those would be the kind of things that we would be looking out for.
Mary, when you were a lifeguard, you were
Yes.
taught about the automatic external defibrillator. What was that training like?
Well, basically, we have another partner that pretends to be, someone who's experiencing heart problems, and then we have this mock-up AED machine, and we would click the button, and it would give you instructions, and then you would just follow it, and then, execute whatever you had to do for the AED to work. And it pretty much is very straightforward and easy for anyone to use. And I think it's really important for the public to be educated on what is out there to help people survive this kind of situation.
Didn't they do a study in Oregon or Washington with 6th graders where they train sixth graders to do AEDs. Can you tell us about that, about the outreach?
Yeah, sure. That's great. A great question. So, regarding automatic external defibrillators (AEDs), we know that the lay public in large can do it. So, grade school students were basically put in a room and said, "Follow the instructions," and they were able to, with great accuracy, use the automatic external defibrillator. So we know it is in fact usable. We know that at major airports, there was a study done at O'Hare in Chicago, one of the largest airports in the world, that over 50% of the people who are resuscitated by bystanders, people just walking by that see someone collapse. So it's not necessarily the personnel of the airport, that actually a bystander, someone who is there on the scene, is the one who actually resuscitates the patient. So we know that these are all really something that's designed not only for trained experts and people who do have training, but also ones that are just walking by. And that's a really important thing, because that will lead to the recognition that the lay public can play a big role and need to be educated and aware of where the AEDs are. So I make a point wherever I go into a sports facility, et cetera, where is the AED? Where is it going to be? If I go into a hotel meeting area, there's likely to be an AED there. Know where it is. There's going to be a lot of people there. If someone collapses, you're going to want to know where it is. And so knowing that it exists, what to ask for, I think is the first step. And I think that alone will, I think, save lives in our communities.
They are now available for home purchase. I know Costco has them. So do you think people should have them?
Yes, no, that's a great question. There hasn't been a recommendation at large that all the general public should have them, but as I mentioned, having them available throughout the community, I think, is an important role. There's obviously still a cost-benefit issue of how many you should have. The cost has come down significantly, but there's still, more than your cell phone, in terms of the cost currently. I suspect in the future the cost will come down even more. I think some of the advances have to be that they need to get even smaller, so that you can, literally bring them with you where you are. And I think if that happens, then I think, yes, we'll see more homes having them, more people having them in larger number of places, in addition to the sports facilities and other public venues that we have them now. More private spaces will likely have these kinds of tools in the future.
I think they're the same cost as the newest iPhone now.
Oh, that's true. It's under $1,000. So I guess some phones are more expensive than others. So I think that's correct. But I would hope that in the future, AEDs will come down in the $100 range or $200 range. I think that certainly in the future, we would hope that's possible, and the number therefore will increase and really disseminate to other both public areas, but also even private facilities.
We haven't discussed young athletes with sudden cardiac death. In the last Olympics, where the runners who were 25 years old collapsed and died. This was the London Olympics. Tell us the thought process of the American Heart Association, the Arrhythmia Societies about this.
That's a great question. So we have a number of different, issues to discuss. So one is that even of screening of athletes and screening of the general public. That's not something that's been totally agreed upon. For athletes in the United States, the Academy of Sports Medicine, Pediatric Academy have all endorsed having a multi-prong approach that includes a questionnaire as well as a physical examination by a healthcare professional. So not just a coach, but someone who is trained in healthcare. So those are, I think, a reasonable start. Some of the questions has been, should you include an EKG or not? In selected cases, should you do other testing? But I think at least we have a baseline way of looking at patients in terms of that. A lot of it's education. If a patient has had dizziness or passing out before, they should probably be much more thoroughly evaluated before engaging in physical activity, et cetera. So I think some of those are some of the conditions. In our younger patients, we know that the causes of sudden cardiac death during athletic performance in particular are different from our older population. In our older population, it's largely unknown coronary artery disease, meaning they have blockages in the arteries. They may have had a heart attack. That's for our older population. For our younger population, usually it's some kind of inherited disorder of which they're not aware. And so that is one of the things that is quite challenging because they typically do not have any symptoms before they collapse, and indeed may therefore not have that opportunity. When people have done surveys, there are sometimes some symptoms that they've had even relatively soon before their collapse. And so that's where, again, we ask people to say, okay, if you're having these symptoms, even though you're young and healthy and you're not suspected of having any condition, those symptoms should be evaluated. And we hope will be picked up by healthcare professionals. But they're often, the awareness is not there. They think, oh, well, I'm young and healthy, I'm not going to have a problem. That's where I think the education can play a big role. That's where parents, trainers, coaches can say, oh, well, you don't look like you're feeling well, we should get you evaluated. And that could be an important kind of strategy. So I'm very hopeful that using more education will identify these individuals and will decrease the risk of sudden cardiac death in these patients.
Dr. Yolapu, you wrote a paper on commotio cordis. Do you want to ask Dr. Wang about this?
I would love to. So I understand that there's been a lot of news incidences, and I've seen a few incidences in the hospital where young athletes come in of sudden collapse after they've been injured. Is there a particular reason or risk that puts these young athletes at risk for that?
Yeah, that's a great question. So first, the condition is called commotio cordis. It is sudden cardiac death due to impact to the chest. And so we've learned in the last few years that this is a very specific finding, and meaning it has to occur with essentially a variety of factors lining up. Within a very short period of time, a few, even milliseconds, the impact has to occur. And so we know that in fact that is what causes the sudden cardiac death. We don't think it's the individual, we think it's the impact, where the impact occurs, when it occurs overall. This was worked out by one of my former colleagues, Mark Link at Tufts, where there was basically a very detailed work in trying to understand why this occurs, and that's our current understanding.
This is a great discussion about sudden cardiac death. To wrap up, for the home audience, the take-home message is if you have a family history of somebody previously collapsing, or you yourself have experienced collapse, syncope, and just falling to the ground and then waking up, to see your primary care doctor, get an EKG, perhaps see a specialist. Again, go to the Heart Rhythm Society website and the American Heart Association. Sudden cardiac death kills 1,000 Americans each day. So tell your friends to look this up, because it's something that we are not aware of in the general public. Thank you for joining us. If you like this show, please make a donation to KSAR TV, Saratoga, California. And thank you very much for joining us for Health Talk.